Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Dr. Earl Trotter, who is Assistant Chief Administrative Officer, as well as Dr. James Bridgers, Acting Health Officer for Montgomery County, and Sean O'Donnell, who is the Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Also joining us today, we have a new guest, Dr. Catherine Kelly. She's a physician owner of Kelly Collaborative Medicine and provider for the county homeless. With that, welcome everybody. Good afternoon. And I toss it to you, Mr. County Executive. Good afternoon.
Yeah, good afternoon, everybody, and thank you for joining us for our weekly media briefing. Start with our COVID rates. This week, our test positivity rate is currently 1.12%. That's the lowest rate we've had since last July. And our case rate is 37 cases per 100,000, and that's a similarly low number. We've been hovering in the 30s for the past 10 days now. Our hospitalization utilization rate is down. And somebody has just covered up my, hold on a second. Sorry about that. Our hospitalization rate is down to 2.2% of inpatient beds occupied by COVID-19 patients. And our hospitalization rates are also the lowest they've been since last summer. I think we've now all heard about the BA.2 subvariant. As we noted last week, COVID cases are surging in Europe and Asia and Australia from the BA.2 variant, and it's increasing hospitalizations there. This past weekend, Dr. Fauci said we're likely to see an uptick in cases in the United States, but is hopeful that we won't see another surge. The bad news is that the BA.2 variant is about 50 to 60% more transmissible than the first Omicron strain. The good news is that this strain does not appear to cause more severe illness or evade immune responses from vaccination or prior infection. The bottom line is there's no reason anymore for anyone to die of COVID, except in the rarest of circumstances. We have vaccines, antibodies, treatments, and now, we never had this stuff a year ago. So we're in a different place and we can keep people safe. And the first line of protection is getting vaccinated. But even if you get sick, we're able to treat it. There's no reason, and it's mostly the people who are going to get sickest are the people who do not get vaccinated and frankly, who don't get boosted, but the non-vaccinated represent the greatest threat. If we ignore this new subvariant and think the pandemic is over, not get regularly tested and refuse to get vaccinated or boosted, then we should expect and be prepared for another surge and the possibility of straining our healthcare system yet again. I don't want to see us repeat what happened last summer when everybody jumped up and down and celebrated and thought, looking at numbers like this, that we were just about done with this, only to be not done with it a month later. So please continue to do the right thing. Make sure you're healthy, make sure you're boosted. One of the main reasons why Montgomery County has a death rate that's 1/3 lower than the national average is because of the seriousness with which the government, our residents, and our business have taken this virus as compared to other jurisdictions. But we're far from perfect. Even though 86% of our population is fully vaccinated, only 56% of our residents have received their booster or an additional dose. Those original vaccines are waning in effectiveness. And even if you've been infected, that wanes over time. But if all you have is your original shots and have not been boosted, you put yourself at greater risk. Those original shots are going to be less effective, and you need the boosters to resume the level of effectiveness that you had before. And good news about vaccinations, we've hit the 71% in terms of pediatric vaccinations. The national average is only 27%. We're 44% higher than that, and that's pretty incredible. And I'm glad that we're up to 78% of our 65 plus population having received their additional doses. But these residents, are the ones we actually have to make sure get boosted. I know, as we saw earlier in Omicron and earlier in COVID period, the older population was the most vulnerable and they'll remain the most vulnerable. So everything you can do to protect yourselves, please do. I encourage everyone to check in on their parents, their grandparents, their friends and neighbors that are in this age group. As we noted week after week, those showing up to get boosted continue to decrease. And our booster rates are lagging in our Black and Latino communities as well as among younger adults. As you can see from the chart on the screen, we've made progress with increasing boosters during the Omicron surge. There was a 17 percentage point increase in white residents, 25 percentage point among Asian residents, 21 percentage point among Black and Latino residents. But the fact is there's a gap of about 21 percentage points between white and Black residents, and 27 percentage point gap between white and Latino, and it's a problem. These communities responded to getting the initial shots. We need to make sure they respond to getting the boosters. We've made a concerted effort since the beginning of the pandemic to emphasize equity in all our COVID operations and outreach. And we're going to continue to concentrate our efforts in communities and zip codes that are underperforming in terms of vaccination and booster rates. I'll talk a little bit about COVID impacts on the Black community. Over the past weekend, the New York Times featured a story that nationally, Black adults were hospitalized at higher rates than whites during the latest Omicron surge this winter. CDC data shows nationally, Black Americans have died of COVID at 1.7 times the rate of white Americans since the beginning of the pandemic. These disparities are also prevalent here in Montgomery County, as you can see from this chart. Our Latino populations are the most impacted by COVID hospitalizations since the beginning of the pandemic and until just before last summer. But since then, our Black residents have been most impacted during last summer and also during the Omicron surge. And when you look at the gray line in this chart that represents the rates of our Black population during the latest surge, you can clearly see how they tower above the rates for other ethnicities. This graph that we're putting up on the screen represents our hospitalization rates per ethnicity over the last 5 months. As you can see, during the peak of the Omicron surge, Black Montgomery County residents were 3 times more likely to be hospitalized by COVID than our Asian population, twice as likely as our white population. We're continuing to focus on these gaps and try to drive them down until we achieve parity again. I'm glad that we have Dr. Catherine Kelly joining us today. Dr. Kelly is an internal medicine specialist in Silver Spring, a member of the Black Physicians and Healthcare Network. I wanted her to share with you what she's seeing and hearing from her patients, as well as the work she and her colleagues are doing to help prevent and reduce African-American hospitalization rates from COVID. Also joining us today is Yvette Gauss, who is a program services coordinator with the Black Physician and Healthcare Network, who's in on our briefing to answer any questions. As I announced last week, my FY23 budget includes a significant funding increase, and we're about to launch a new marketing and outreach campaign that will be targeted toward our Black and Latino residents and communities to better promote and encourage vaccines, and especially the boosters. Yesterday, was the last day of the Health Resources and Services Administration covered costs of COVID-19 testing and treatment for the uninsured. So yesterday, this group ended coverage for the uninsured for getting tested and treated. I cannot imagine why they made this kind of decision, other than the fact that Congress has failed to provide the funding to the Biden administration to continue this work. This is a national embarrassment. Let's be honest about this. The idea that we would leave the most vulnerable populations out there, the people who are most impacted economically by COVID, and the folks who started before COVID with the lowest income rates in this country, that we're going to pull the plug on covering vaccinations for people who aren't insured, seems to me to be a disaster, a recipe for disaster. It is unconscionable. And I hope that Congress can get its act together and actually legislate to protect us against future surges and not repeat the mistakes that were made this time last year before Delta, when people thought it was over. We need to be doing the most we can do to make sure our population is protected, not the least we can do. And the money we save by not spending on this is probably dwarfed by the economic cost to the county and to this country that COVID has produced and these surges produced. It's just bad math, bad economics to put these people at risk. The uninsured are the working poor and the disproportionately people of color in our communities. They're dealing with increasing gas prices, rents, and food, don't have the incomes to even remotely deal with it. This is not the time. Between now and April 5th, we will be focusing on getting word of this deadline on coverage of vaccines and boosters out to the uninsured. And I will continue to let our voices be heard at the national level that we hope they can resume this level of support for the community. On test reporting, a little reminder, we've distributed 2,144,000 rapid tests that have been acquired by the county. More than 1.6 million kits we've had more than 2.144 million rapid tests acquired. More than 1.6 million kits have already been distributed. 887,000 kits and 1,067,000 masks have been distributed at libraries. 490,000 rapid test kits have been provided to MCPS. 135,000 test kits and 232,000 masks were distributed to childcare, private schools, and community nonprofits. And 48,000 rapid test kits and 124,000 N95 masks have been distributed through our municipalities. I continue to be really impressed with our take-home rapid test kit and mass distribution. I want to thank our libraries, HHS, emergency management, and procurement departments for their continued efforts to make these resources easily and readily available throughout the county. There may not be lines out the door for these tests as there were just a few weeks ago, but they're still providing thousands of these tests to our residents every day. The proliferation of take-home rapid tests has been a game changer for county residents and families. However, we know that many people are taking the test, testing positive and doing the right thing, but they're not reporting the positive cases to us. It would be really helpful, folks, if you're doing these tests, to report the results of your tests. It helps us map COVID and get a sense of how much COVID is actually out there. And to the extent we're missing the results of these test kits, we have less than perfect information about what's happening inside the county. So help us out with this one, please. There are plenty of COVID cases circulating out there that we don't know about. It's important that we get this information. This month, as we've mentioned before, is the COVID Anniversary Remembrance Month. Over the past 3 weeks, we've been recognizing the second anniversary of the pandemic by honoring those we lost, as well as highlighting and appreciating our healthcare community and our housing efforts. This week is Essential Workers Week in Montgomery County. I want to thank all of our essential workers for the hard work and dedication to serving our communities during the pandemic over the last 2 years. These essential workers, they are the frontline workers, whether it was in the private sector or in the public sector, who stayed on their jobs and continue to provide services, going all the way back to the beginning when we didn't have, first we didn't know we had to wear masks. Then when we had masks, the first masks we got were not really as protective as they should be. And we lacked personal protective equipment. We were building, separations in at least our places of employment. And I've seen this in retail stores as well, keep customers from having close contact with employees. But those are all things we did. And these folks continued to work in their public facing jobs when all this protective equipment was in short supply and before the vaccines were available. They made it possible for our residents to get the services they needed while staying safe and healthy. And I just want to, thank them for everything they did and recognize the sacrifice and the risks they took. This week, we're honoring all counties' essential workers, from our grocery and retail store employees, our healthcare workers in the private and public sector, our own police, fire and rescue services, our teachers, our childcare providers, our government employees, and all the staff that works in schools. They're not teaching, but they're the ones that kept the schools clean and safe, and they, deserves thanks as well. It took everybody working together to get as much done as we were able to get done. I encourage all residents to take this moment this week to thank these workers and show their appreciation for the service and for the risks and sacrifices they took to ensure that our essential needs were met throughout this pandemic, I should say. On the subject of cybersecurity threats, finally, due to increased tensions with Russia over the war in Ukraine, both President Biden and Governor Hogan have put out warnings about potential of imminent cyber attacks. We're taking this threat very seriously in Montgomery County government. Actually, we've been hardening our systems for a while now because we recognize this is an ongoing threat. It was a threat before the Ukraine. It's more of a threat now. We average over 15 million events per day that are logged. And events are activities like a normal email received by a county employee, an attacker checking to see if we are vulnerable to a security hole, or someone logging into the VPN. On average, they are not malicious, but they need to be analyzed in order to determine that. And we average over 40,000 malicious attacks per day that are tracked by our automated systems. These tend to be from overseas and range from phishing email up to nation-sponsored attacks. Before pandemic strike, I actually visited the cyber center in Montgomery County, and I was in a very large room with all these large screens on the wall, and it was amazing because what you could see there were attacks happening in real time, arrows originating in one location, often overseas, and landing someplace else. It recorded the attacks both on the United States and attacks coming from within the United States. And the attacks were going all over the world. It was really alarming to see that at the scale it was. Having it visualized and having watched it just continue over the time of my visit was kind of breathtaking. And it gives you an idea of the severity of the threat and also the amazing amount of work that's going on all levels to try to protect people from these cyber attacks. It's serious business, and we want all our employees and residents to be mindful of the increase in degree and sophistication of these attacks, as well as to be prepared for any issues that may arise due to one. And with all of that, I want to thank you, and I'm now going to turn it over to Sean O'Donnell, Dr. Stoddard, for their updates, and then we'll hear from our guest, Dr. Kelly, before taking your questions. Thank you.
Thank you very much. Just would like to share some of the updates on. Can someone just confirm that they are seeing the pulse report?
We are.
Thank you. So I just want to share just a little more detail on some of the updates and what we're seeing. One thing of note, as the county executive explained, our hospitalizations are significantly down. Currently in our main hospitals, we do not have any COVID patients in our ICUs, which is very heartening. And we're down to 30 total patients with a COVID designation. As was mentioned, and the reason that we've included all of this information again is how important it is for us to share with our community the protective effects that we believe that being fully vaccinated bring, and this is why we've shared the higher case rates by ethnicities, as well as the booster rates that we see that appear to correlate in these rates. We also appreciate that this information has been provided through the media to, in some cases, in an even more compelling fashion, which includes real people's experience with tragic experience with COVID. We very much appreciate you helping us get this message out to the community. Again, we've shared this in past weeks. We've continued to monitor the death rates by vaccination status within our county. We know that you can look at these across other jurisdictions and states by looking at the CDC's website. You can also look at the impacts that these are certainly different at different age ranges. We know that the vast majority of our significant illness and deaths are occurring with those that are 65 and above. But our overall rates, again, showed tremendous protective effect from being boosted. As the county executive mentioned, we are seeing increased BA2 variant proportions. This is our stratified to just our region, where we're seeing about 30%. Across the nation, it's about 35%. And from the CDC's tracking, they are, I think, the highest rates of BA2 is in the Northeast now. The New England portion of the CDC's monitoring, where they're up to almost 55%. We're seeing a little bit more COVID activity there. More testing is occurring. They're identifying with that more testing some additional cases, but it has not yet exploded in any part of the US. We're continuing to track that again internationally as well. And looking at our total vaccination rates, again, we're continuing to see some movement of those populations, especially the youngest population. And as noted, while we're happy to hear that we're doing well in the county, there's still a significant amount of our 5 to 11-year-olds who can come out and be vaccinated. So we encourage their parents to make an appointment. There's still lots of opportunities to be vaccinated, of course. Again, just sharing the additional dose rates, which largely corresponds to the booster rates by age and by race and ethnicity. We still see a significant disparity, particularly at the younger ages. And our highest concern, of course, is increasing those booster rates with our 65 and older populations. Again, the vaccine immunity wanes over time, whether that immunity is from an exposure to one of the COVID variants or from vaccination. So it's very important to get that booster 5 months after the initial or your second dose. That is all the data that we have to share today. At this point, I'd like to turn it over to Dr. Stoddard if he has any additional remarks.
The only thing I will add, no additional remarks other than to say that the pilot we've been doing with the PCR testing has been very positive so far. We've had a lot of kits picked up, had far fewer return, which is okay. People are keeping them at home and keeping them available. But what we have seen is all the results within 24 hours so far. So we got a lot of questions from the county council about the turnaround time, and while we expect that could go up if we see a surge in testing need. Right now, the test results are coming back very quickly. So that's the only update that I want to provide. I will turn it over to Dr. Kelly next.
Good afternoon. Thank you for having me. So in addition to my role as a primary care physician here in the county, I also am the county contractor for healthcare for the homeless for primary care and the newly open medical respite. So some of my perspective is from primary care in the community, but also from the population that's disproportionately affected, and that also is disproportionately African-American and Hispanic. And I think that the increase in the hospitalization rates among Black residents and African-Americans in general is a direct reflection or manifestation of the already noted health disparities that we're seeing when it comes to inequities in access to healthcare and other social determinants of health. At the beginning of the pandemic, I think what we saw in the Hispanic community, there's multiple households that have multiple generations. And so we were seeing a spike in accordance with that. And now I feel like in the Black community, especially in the patients that I have, it's not only those health disparities, but also still increased vaccine hesitancy and some mistrust historically of medications or medical providers. And, part of the solution, I think, is going to be something that the Black Health Providers Network and programs like the African American Health Program here in Montgomery County are doing, is trying to coordinate Black patients with Black physicians As an African-American female physician, we make up less than 2% of all physicians in the country. So making sure that you're finding physicians that look like you, that you can trust, or you feel that you can trust, is going to be important, but also having other physicians who may not look like them be trusted allies is going to be important. I also have seen a lot of misinformation and the proliferation of that misinformation in social media. So a lot of what I try to do in my practice and what we try to do with our homeless population is to actually give them the correct information. The numbers that you just showed that show that there's a benefit to being boosted, even though you're already vaccinated. And also what I found is that it's actually my more educated African-American patients who have more hesitancy and question actually being vaccinated at all. I think we also need to continue what we're doing with going into the Black community, into the Black churches, and building that trust among those populations. And in the Hispanic community, I know there's the Latino Health Initiative, and they've also had some initiatives recently to go out and push for vaccine boosting and vaccinations in general in those populations. And I think we have to continue to do that moving forward.
Let me remind myself to unmute. Thank you, Dr. Kelly. Thank you, gentlemen. Let's get started with a Q&A portion of this presentation. Corey Smith, NBC4. I believe you have a question. Good afternoon, Corey.
I do. Good afternoon, everybody. I guess a couple of questions for whoever wants to answer it. You called the deadline for coverage for the uninsured folks. That's coming up. An embarrassment. What steps is the county taking to, I guess, fill that void? Once that funding goes away and those folks, the uninsured folks can't get those costs covered. And do you have a percentage or ballpark number of how many Montgomery County residents are uninsured?
I don't know that we have that with us. We can certainly find that, Corey. We've already started to see some feedback that we're seeing residents. Actually, the deadline was yesterday, so today is the first day where if you went and got treatment or testing, that you would not be eligible for that cost coverage. Vaccination, I think, is maintained through April 5th, so that has still another week and a half or so before that ends up happening. We could figure out the number of uninsured. I would only note, and I'm sure Dr. Bridges could chime in on this, or Dr. Kelly could probably chime in as well. We have a number of programs that the county provides to address health for uninsured individuals. And so obviously, if there's someone who is in need, they certainly can reach out to Health and Human Services in our eligibility unit. If they need to get a number, they can just call 311. They'll be connected with Health and Human Services, and based on their eligibility, they'll be placed in one of the multiple programs. Then obviously the county has provided substantial funding to cover a lot of these services directly from the county. So you're not going to go to a county testing site right now and be turned away for any reason. We're going to continue to do that and cover those costs already. I want to make that clear. But it really, when people go to hospitals or other private providers, they may experience these issues based on insurance status. But I don't know if Dr. Bridges wants to say.
Sure. Great question, Corey, and thank you, Dr. Stoddard. So we will continue to provide those services through our community and population health service area under public health services within HHS, through our Montgomery Cares Clinic, which are supported, and our county executive mentioned that in part of his opening remarks about his budget recommendations for this year and in previous years. So those individuals will still be able to receive support. As Dr. Kelly indicated, the services to end and prevent homelessness, some of the services that she provides through her office will still be available. We will still continue to test and provide vaccinations for those individuals. So we will not break the continuum of care. The services that were set forth or funded by the Health Resources and Service Administration complemented, if you will, or enhance those those funded program activities. But we will continue through those initiatives that we have in place until otherwise directed by the feds or through the CE's office. But we will continue those platforms under the Health and Human Services umbrella.
I was just all of the testing sites that are directly referenced on the county's webpage, whether it's run by HHS or one of our community partners, those They may ask for insurance, but they are all no out-of-pocket costs when you go to them. So just to confirm, if people had any questions, you can go to our website, and those partners are all covering the administration and the other costs.
Thank you.
Somebody answering that? Okay, I guess next is Rebecca Tan with the Washington Post. Good afternoon, Rebecca. Thank you, Corey.
Thank you. I know that Dr. Kelly went over some of this, but I'm wondering if either Dr. Stoddard or the county executive can say what specifically the county is doing to increase booster rates in the next 2-3 weeks or the next month.
Sure, Rebecca, I can respond. So within Health and Human Services and Public Health, we're working not only, as the county executive indicated, those booster rates for all of those individuals who are eligible. So we're working with our community partners, we're working with our Montgomery County Public School system to have a booster before spring break. Within the next couple of weeks, we're going to have a booster community event where we have our local historically Black colleges and university working through the AHP, African American Health Program, and partnerships, and our BPHN to support those vaccination rates. So we have continuously looked at our booster rates, as Mr. O'Donnell indicated, around 53. So we're looking at those spaces based on our zip code analysis, our census data that I think we provided to you, and targeting those individuals, especially in our Black and Hispanic communities, where we know we want to increase those boosters. And so we are looking at them and assessing them ongoing. But in addition to providing or having booster clinics available, as Dr. Kelly referenced, we have educational information to decrease any vaccine hesitancy and vaccine apathy, because folks feel that they are fully vaccinated. Now we've been responding to and now recovering from the most recent surge. And so there's some apathy. Folks are hesitant. And so we're addressing those issues now along with the booster. So that should be a combined message, not only to get boosted or staying up to date according to CDC, but also the educational pieces that go along with that.
Got it. And a related question, can you talk a little bit more about what else the county is doing to prepare for a possible next wave, and specifically what it's doing to avoid the level of sickness and death that we saw even in a highly vaccinated community like Montgomery County? What is it doing to avoid that level of sickness and death ahead of the next wave?
Sure, great question. I'm going to turn this over to Mr. O'Donnell, who has been operationalizing most of this, and let him respond to our plan that we have in place to not only address any particular uptick in cases if we see a surge, which isn't expected based on the research that we're doing now, but operationally how we continue to not only test and make testing available, as Dr. Stoddard indicated, by providing those kiosks, those PCR-based kiosks in the community, but also our vaccination strategy. So, Mr. O'Donnell.
Thank you. So, amongst our plans here, one of the keys are to be able to increase the resources that we have out to the community. One of the key resources we've made available is testing, so that individuals can determine if the symptoms they're having is COVID or something else. We've talked about the increased availability of rapid tests that have been distributed already out to households. I'm sure many of the households throughout the county have these at home already. And now the new initiative to have PCR testing also available throughout the community as something that they can do at home and drop off to be taken to the labs. So that piece it continues to exist. We still have our community testing sites, so that will help with the personal identification of cases. It'll help with our community understanding. We're continuing to do our outbreak investigations and monitoring at our congregate settings, including our monitoring at schools, including our monitoring at nursing homes, assisted living. these are often the places because of the congregate natures and the sensitive populations where we see the first set of cases. We saw during Omicron, we saw the numbers go up significantly in our test positivity and these other community locations before we start to see hospitalizations. We expect to see that before we start to see the hospitalizations. And of course, we're also tracking emergency visit data through the Essence program. So that's how we're looking at all of that. We saw during the Omicron wave, the significant increase in people coming out for boosters from the beginning of Omicron through February, and that's the data that we've shared with you today. And I do think that disease threat did motivate a number of people to get the vaccinations. Of course, that'll continue to be available. But one other thing that we've talked about is the community interventions. We know that mask mandates have gone away in most of the country at this point. We know that many of the social distancing restrictions have been decreased in Montgomery County, of course, and in lots of other places. But what we've talked about is having, when the need arises, or if the need arises, to have focused implementation of some of these measures at places where the greatest risk occurs, just the same way it did at the beginning of this pandemic, where assisted living facilities and nursing homes became the first place where social distancing and masking was implemented. We're also looking at, this would very likely be guidance pushed out by public health to these different groups to do this, as opposed to the first step would not be a universal mandate. It would be the guidance is pushed out to the groups at greatest risk, but it's really connecting this information with the public in a timely fashion that we think can help control and limit the breaks. We limit the outcomes from COVID. We've seen a very significant decrease from year 1 to year 2 and the number of deaths in Montgomery County, a more significant decrease in Montgomery County than almost any other jurisdiction and across the state. And we do think that is partly from the high vaccination rates, but also because our population is very responsive to the information we provide to them about protecting themselves.
Rebecca, I'll give you a quick summary, I think, of a lot of the major activities. So obviously, we're going to continue to provide PCR testing, rapid testing, and high quality masks through our libraries and rec centers and other places. We're going to continue to provide vaccinations, both first dose and boosters. We're continuing to plan for, we saw Moderna submitted their request, or will be submitting their request for the 6-month through 4-year-old category. And so we're preparing to do that. We're anticipating that there will be boosters beginning particularly in May for some of the likely the 5 to 11 population, and even the, some potentially additional adult dose. We're preparing for that. Continue to work with Montgomery County Public Schools around what they're going to, their plans for example, their spring break is coming up, but also be in conversations on what happens for next fall and how do we encourage people who are maybe eligible for boosters over the summer and get them to come back. We are looking into wastewater surveillance. That's another area where we're trying to collaborate with both University of Maryland and WSSC to do something there. We'll have something more to talk about as that gets finalized, but we are working in that space as well. And so we're trying to go across the board at all of these different modalities and methodologies to both increase our information about COVID spread, have the tools in place. We're going to have contracts that allow us to expand those services, both in terms of vaccination testing, but also making sure we have contracts in place to have a stockpile of PPE, but something we could surge, a stockpile of rapid tests, but something we could surge. And we want to make sure that there's diversity in that testing capabilities so that, if there's a new variant that emerges, we aren't stuck with one single variant of rapid test that doesn't end up being effective. So we're going to have at least 3 or 4 different rapid test variabilities in our stockpile, but also 3 to 4 different contracts that we can get local, particularly local surge capacity in rapid testing capability. So we're really using a very diverse strategy to make sure that we're in a good place so that we're be ready for a surge, while also continuing to educate people that they play a huge role in preventing such a surge by getting vaccinated and doing the practical things that we know work.
And Rebecca, the only piece I want to add is that the county executive has been pushing since January to get antivirals in the county, such as Paxlovid, so that we can be able to test, to treat, and have providers such as Dr. Kelly to be able to have those antivirals and those prophylactics. So as Dr. Stoddard and Mr. O'Donnell indicated, we have a very robust plan that's ongoing and that we continue to refine and evaluate to respond to not only any surges on the horizon, but any future subvariants.
Got it. Thank you so much. I really appreciate it.
Thank you, Rebecca. Up next, Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Afternoon. This first question is just a clarification. So for the deadline that HHS, I pulled it up at the federal deadline for April 5th for reimbursement for vaccines. So if after that date, residents go to a county-run clinic, is it still no cost to get vaccinated? Or I just want to make sure I understand that.
Yeah, so HRSA is not where we go. It's really the healthcare infrastructure that goes through HRSA for their reimbursement. For the county, it's largely we're obviously utilizing taxpayer dollars in the front end. Then we seek FEMA reimbursement, which is a different system from HRSA, and it's still FEMA is still 100% no match requirement through the end of June. And so obviously there's a little bit longer time frame on that. After the June 1st timeline, it moves to 90% reimbursement, 10% local match. So unless there's another change in that timeline, but people will still be able to go to vaccination or testing clinics in Montgomery County and not be charged at a county site. However, for example, if you went to an urgent care or you went to a hospital, that may not, that no cost standard will likely not apply there.
And so I'm guessing maybe Dr. Kelly or anyone can weigh in, but I want to hear from Dr. Kelly about what impact this might have in the community, especially for people of color and people who are uninsured.
I definitely think it can have an impact because we're going to have to do a better job of directing them to other resources. I think as Dr. Berger said, there's multiple resources in the county that would supply them with the same things. It doesn't have to go through that program. I know for me personally in my office, we have access to free vaccines and we will continue to give them to our patients in the office, whether they have insurance or not. And that's got to be a commitment from the physicians because we know that being boosted is making a difference. But they can also go through those programs and we direct them, to Dennis Avenue and other sources where they can get the same care or the same access to those vaccines.
The one thing Dr. Kelly highlighted that I think is really important is that so much of what happens is word of mouth. And so you don't want someone who ends up getting charged at a hospital to suddenly think and spread news that, oh no, you're gonna get charged, don't go get vaccinated. Because that's the thing, we'll have to do a lot of education and have people understand that there are other resources in the community. But what we've seen is you see these impacts when things happen, like we saw when the Johnson & Johnson vaccine was taken off for a few weeks. We saw a huge change in the people coming forward to get vaccinated across the board, even for non-Johnson & Johnson vaccines. And so obviously it increases the burden on us collectively to do more education, to have people understand, like, if you can go to these other places and will not be charged. And we have to constantly be able to hammer that home because people have word of mouth experiences when they go to a hospital, for example, and they may get charged, and that will obviously dissuade others from going to all services.
I'm going way back to the beginning when Mr. O'Donnell was talking about or actually I think it was the county executive mentioned that for our pediatric vaccination rates, we're at 71%. And I'm wondering, just to clarify, is that from 5 to 11, everyone is like 71% is fully vaccinated? I just want to clarify that data point.
That was 5 to 11, approximately 71% have had a first dose, and it's approximately 60 to 61% are fully vaccinated.
And that's still higher, considerably higher than national average. I'm just wondering what you think. Obviously, that's a good sign, but what has allowed you to excel versus other jurisdictions in the state and country, I guess?
Well, there's a lot of factors here. First of all, we probably have the highest percentage of their parents vaccinated. And so we've already overcome any hesitancy their parents may have about the vaccine. It's for most of them, it's the same vaccine they received. It's Pfizer, it's just a different dosage. That's, I think, really helped. We did a lot of planning before this rollout, particularly with a lot of community members, but particularly with Montgomery County's public schools. We saw the success we had at the tail end of the 12 to 15-year-olds, where we turned to the schools and we uncovered lots of members of the population who hadn't been vaccinated yet. And we saw how powerful the messaging MCPS has, in particular their principals and their central office, when they reach out to our community families and say, we're having a vaccine event and we encourage you to come out. For many people, that was the authority figure they needed to hear from. A lot of people say it's their doctor as well. But the challenge is getting them to go see their doctor to have that conversation. And a lot of people say, I waited till my doctor said it was okay. So we encourage our doctors to proactively talk to their patients even before they make an appointment. But for us, those principals in the school system has been extremely helpful. We worked on a plan to ensure that we were getting out to the community. We knew that pediatricians were going to be heavily involved in the 5 to 11 and that parents wanted to go to pediatricians. We focused our efforts on ensuring we were getting to populations who had less access to pediatricians. We went to all of our Title I schools. We communicated with the families there and at the focus schools over and over again to try to increase the rates amongst the harder to reach populations. We know that when you try to get a 5 to 11-year-old vaccinated, it's not just when they're available or what they want to do it, it's when the parent's available as well. So we had to hold clinics on weekends and evenings to be available to them, but also over and over again until they found a time in their schedule. Lots of other priorities with our families between work and other activities that they have to do. So it was being available, being accessible when people were ready to come out. This go around has been a little bit more of a slow stream than a quick turnout like the other groups were. So those are all factors, but really it's the partnerships we've had. Our Office of Community Partnerships have been amazing. They've gone door to door in trying to increase awareness of what we're doing. Our partners in the private clinical and the PTA have tried to hold events around some of the things we're doing. They're still holding events on weekends to increase interest. But really it's the community being accepting of it and being interested in getting their children vaccinated. That's really helped. But and again, thanks to our MCPS partners. Stephanie Izzard's been amazing in helping us to schedule these, in reaching out to the schools, and they've canceled events that they're having at the school so we could have vaccinations, and that's been really, really helpful. So now hopefully they can have those events because their kids are vaccinated.
And can I just add, I just wanted to say, one of the things we've seen with the pandemic is also a delay in preventive care. So a lot of these kids aren't going in for their regular visits. So a big part of, I think, getting more of them vaccinated is going to be actually encouraging them for their routine well visits, so that the doctor can actually have the communication with them about all of their health determinants that we need to be addressing, both as in adults and in children. In the state just sent out a physician packet that we did for CME that also addresses that, and trying to get more adults caught up on preventive screenings for colon cancer and those kind of things, so we can have these conversations in the office in a space where we're talking about what we can do moving forward, so that they can be ready for when it's time to get another booster, or even especially our patients who are compromised, who need a 4th dose, to also encourage them to get those things at that time.
Very, very thorough. The last question I have, I think Dr. Stoddard might be best positioned to answer. I was listening during yesterday's council session, Dr. Stoddard, at the very technical kind of discussion about the Police Accountability Board legislation. And you said at one point that the administration will be concerned if the corresponding state legislation would add unfriendly amendments during the recruiting process? I know you said you're still waiting on the language that they were going to draft. I just kind of want to ask you for an update there in terms of what's going on.
Yes, so the Maryland Police Training and Standards Commission is developing a regulation that's related to House Bill 670, which was enacted by the legislature last year, that provides some governing structure to the way that the police accountability boards and administrative charging committees operate. They've interpreted that authority fairly broadly and added things like eligibility criteria to the state regulation. My understanding is that the Maryland Police Standards Training and Standards Commission has voted and approved their set of regulations and are currently formatting them for posting in the Maryland Registry. I also believe that those need to go to the ALER, which is the Legislative Review Committee that cannot make changes themselves, but either can accept or reject that regulation and send it back to the MPTSC. Now, my understanding is we should be seeing those sort of voted on from the commission standards over the next several days to week. But I have been told that they will include some provisions that we did not believe were appropriate, including a prohibition on ACC members having been convicted of a felony or a misdemeanor of more than 1 year, as well as requiring that any ACC members be legal U.S. residents, which would obviously prevent people of certain immigration statuses to be members of these committees. We do not know whether that carries over to the Police Accountability Board itself, or whether it's specifically for the ACC or not. But obviously, we do know that that would have a dampening effect on those who might be really qualified and be great members of our PAB and or ACC from applying. But obviously, we need to see the final language to know how restrictive it really is. But we're under the expectation that there's going to be some requirements in there that we don't agree with. Our view has been, and obviously this is a regulation that applies statewide. If there are certain jurisdictions, and we wouldn't encourage them to do so, but if they wanted to be more restrictive, they could have a policy that's more restrictive about who they select. At the end of the day, these are nominations from the county elected leadership in all the counties across the state. Our view has been that the state shouldn't be restricting what local jurisdictions choose to do with regard to this nomination process. And we much prefer to have the flexibility and latitude to consider good candidates and select from the full pool of candidates, the best candidates that can represent our community on this board and committee. So that's where we're sort of at here.
You probably said this already, so I apologize. But if that change happens, the council bill has to reflect that, right? And moving forward, you'd have to amend it. I don't know. They're supposed to vote on this next week, but I guess they might have to come back and amend it to reflect all those changes you just outlined.
Well, so I don't think necessarily that you would need to. So certain I think provisions within the proposed council bill do say that this the member has to meet the standards as established by state regulation. And so that would automatically govern some of these individual provisions that would be in the state regulation. Now, the point, though, is that this state regulation is now also subject to review, public comments, and feedback from the legislature. I would hope that public comment would reflect our view that, hey, maybe you shouldn't be so restrictive on what local jurisdictions do. And I would hope the feedback from the legislature says the same. And then maybe the commission will ultimately change their draft regulation before it's finalized, probably in June. Now, the problem is that we have to operate under certain assumptions, and we can't assume a change is going to be made, and that will therefore influence potentially who we can select and nominate, because we don't want to have a situation where we nominate someone, have the council confirm them, and then have them later have to be removed, and thus not having a functional board or committee in that interim phase. And so we're trying to wait till we see these final drafted guidelines and make some decisions about what we think we can deal with and what we can't. and then make our selections based on that. But we in order to meet the expectations of the legislature, we're going to have to post these applications for selection sometime next week is my sense, on the 30th, I think is what our intention is, a week from today. And it's going to really hamstring our ability to pick the best candidates if we've got these state regulations that are going to narrow the pool of candidates we can choose from.
Yeah, and sorry, last question. The PAB and ACC, one of them is paid each member $16,000. I don't remember which one, but I know Councilmember Jawando had suggested that that should be the pay for the other board. I was just curious if the council or the administration, the county executive can chime in if he wants to, is supportive of that level of pay for the board or whatever the council establishes. I just want to make sure that the administration is supportive of that as well, I guess.
Mr. County Executive, you want to chime in, or certainly we've talked about it.
My assumption is that we're all going to wind up on the same page. We're trying to get everything to align. That's the challenge.
I would say generally, I think we've talked about this. We don't have any concerns about the PAB being compensated if the council does that. We recognize the particularly challenging job the Administrative Charging Committee, who is currently in the bill compensated, has. But we recognize also that the PAB plays an important role and is really taking over an executive branch function of the police chief in helping dole out this discipline. So I think the council, with the PAB, their roles is slightly different. So it's a little more ambiguous, but I don't think the county executive has expressed that he doesn't have any strong opposition at all to the PAB being compensated as well.
Thank you. Thank you, Steve. Next up, Kate Ryan, WTOP. Hello, Kate. Good afternoon.
Hey, how are you? Thank you so much. Dr. Kelly, I had a question for you. Actually, a couple. You mentioned that there's misinformation out there still that you're having to work with people on unraveling for them. And I'm curious as to what the source, is there any one particular source? And then when you're trying to provide people with correct information and persuade them that, hey, getting your booster is really going to give you the ultimate protection, what's the winning argument? Is there one thing that pops up over and over again, like okay, now I understand why I would want this? And I'll tie that into what Mr. O'Donnell was saying. I think people do look at their local schools as, that's my kid's school. I can trust them. They know me, et cetera. Do you find the same thing? So I asked you a lot, but I'm curious as to what your experience is.
Yeah, so in terms of the misinformation, I think the majority, 99% of it is from social media. So it's like this one person that said something on Facebook, or this one person on some of the doctor sites that people will put their issues on, and it's not founded in fact. So what I have this conversation with them, and I don't see kids, but I tell them I don't argue with adults. Like, I'm going to give you the information. I want you to trust me. If you trust me to be your physician, I also want you to trust me that I'm going to give you that information. And I also try to break it down with the facts that we've seen on this. So one of the big arguments that I had was, not only they're going to be protecting their family, but the risk of dying from COVID dropped significantly. Yes, they still may get infected, but there was, I think it was 0.1 per 100,000 was the rate for those who have been boosted, 0.5 for those who had just been vaccinated. And then the death rate per 100,000 was, I think, at 5, which is a 50 times increase for those who had been boosted. You also have to go through and talk to them about the side effects. So, and understanding that with any vaccination, there's side effects. A big one that I get is that the messenger RNA vaccines can change your DNA, which is not true. So just going through and talking to them from a non-judgmental standpoint and giving them the correct information, and then letting them have the freedom to make the decision, because they do have that right to make that decision. I don't discharge patients or anything because they choose not to be vaccinated, but I also want to make sure they understand the importance of vaccination, and also that vaccination has been a proven tool in medicine to prevent disease. So we talk a lot about how rapidly these vaccinations were developed, but we also have to educate them on the technology, and that the technology has been there for 10 or 15 years prior to it being applied in this form. So I think some of it is just I try to rationalize it as much as possible, also let them know that I'm listening and that I hear them and hear their concerns, but to give them the correct information on the other side.
Gotcha. Okay. Thank you very much. And then just as a follow-up, Mr. O'Donnell, and forgive me, I'm late getting into this. When you mentioned 30% of the COVID cases, is that in the county or the BA2 variant? Do I have that right?
Sorry, I lost control of my cursor for a second to unmute. So that the numbers I shared earlier, that was from the CDC's tracker, and it's based on CDC regions. So that includes multiple states, and the District of Columbia includes Delaware, DC, Maryland, Pennsylvania, Virginia, and West Virginia. And they track this in each of their regions across the country. And they, I'll tell you the number they have here is 30.2% BA2. But like I said, you can go to the CDC site and pull this up for any of the regions and see how it compares in the different regions. But across the country, it's about 35% BA2. And they use a special analysis that's a little bit predictive because it takes a little while for them to have all this data come in and compile it. But there's a couple different groups that are, of course, looking at the different strains of this and typing it. So you'll get slightly different information. But as we see that this is the proportion of the total COVID cases we see, and we're likely to see that proportion continue to grow, even if we see more moderate actual increases or continued decreases in the total number of cases identified.
Gotcha. And then when, again, I'm curious about, you mentioned the role that principals have played in getting people in, and like, this is a great place to get your vaccinations. We're here for you. Was there any area of the county where that was most effective?
I don't know, because we did it universally across all of our, in our messaging across the schools. We initially picked, for the initial rollout, when we knew there was high volume, we picked middle schools because they have more parking, they have bigger space. But those middle schools that were selected were all tied to Title I schools and focus schools in their geographic area, and they were messaged out based on that connection. That was our weekend clinics. We also did clinics in cooperation with Holy Cross and Care for Your Health weekdays after school at specific schools, where because of the timing of it, those were a little bit smaller. But yeah, we messaged out through all of them. I don't know particularly, which of the principals had bigger sway over the groups, because they were talking to not only their own school, in some cases they were talking to the feeder schools in the area. So, but we did the very first place we did it at over the summer, we did it at Argyle Middle School, and that principal did a fantastic job of getting students out. A lot of African-American and Latino students who had not been vaccinated yet. We essentially, when we held those clinics, we doubled the number of people we vaccinated at that site, doubled the number of people we vaccinated for the day. So we knew that was an effective tool, and that's why we based our public strategy of getting vaccine out around that, knowing that we were, many of the families in our community were going to go to pediatricians, and we made sure that our pediatricians had vaccine early on. Some were able to order it directly from the state. The state also gave us a list of pediatricians that asked for smaller amounts, and we made sure to get it to them. So it was a partnership, and I don't want to minimize how much our private clinical community did. They've done most of the vaccinations. We saw initially, we got it out quickly to those families that really want their kids vaccinated immediately. But over time, the private medical practices made up more and more of that, of the vaccinators.
Okay, last question, I promise. Abuelina, is she out there telling people to get their boosters? Are you still employing that strategy?
She never gets a day off.
Thank you.
Thank you, Kate. And on that note, I think that's the end of reporters' questions for today. Thank you, everybody, for joining us. And my internet, it's very unstable. Thank you, everybody. Have a great afternoon. Stay safe. Thank you, Dr. Kelly. Thank you, Ms. Goss, for joining us today. We'll see you next week. Bye-bye.
Bye.
Bye now.